This is Crystal Fenn with MedPage Today. For women carrying genetic mutations that dramatically increase their risk of breast and ovarian cancers, preventive surgery not only reduces risk of cancer, but also improves survival, as a new study in the Journal of the American Medical Association has affirmed. Dr. Judy Garber of the Dana-Farber Cancer Institute commented on why these results may be important for physicians and patients alike.
These data will make it easier for physicians to encourage their patients to consider surgery, and for women to begin to plan when in their lives those risk-reducing surgeries are really best for them. When should they consider, most importantly, having their ovaries removed? Because in this study, having the ovaries removed conferred all kinds of benefits. I think it's most important to tell women this when they're thinking about genetic testing. So when someone comes in and says, I have a family history, and you say, well, there are things you can do with the information if you decide to be tested now, but some of those things are surgeries. That may be information that's easier for someone to hear at one point in their lives than another. It's difficult to decide, to look and know whether you have a mutation. But these data at least should help women feel that there's something they can do if they're found to have this level of risk. These are very high risks, and for people who feel that they would be really very anxious and worried all the time and not be able to do anything about their risks, these data say that that's not true. You can take care of yourself, you can prevent cancer, you can prevent death from cancer, even more importantly.
The study uncovered the greatest benefits with prophylactic surgery to remove the ovaries and fallopian tubes, but also a reduction in breast cancer with prophylactic mastectomy.
I think for women with mutations whose risk of cancer, either a first cancer or a second one, is so high, and with such clear data that surgery can prevent breast cancer, it's difficult to say that mastectomies are overused. But there are other circumstances where there is concern that we're doing much more surgery than we used to, and that perhaps some of that is not necessary. I think that for women who have an early breast cancer diagnosis and these days more often want to have bilateral mastectomies, have both breasts removed to avoid having cancer again, there's a lot of controversy.
So reaffirming the benefits of risk-reducing surgery can help women decide to get tested for BRCA mutations, but also to determine what to do if the results come back positive. I'm Crystal Fenn, MedPage Today.